Hi, good afternoon.
Hi, Dr. Weintraub.
How can I help you today?
So I was noticing my frown lines here and then my horizontal lines are getting much deeper than they were, 3 or 4 years ago. So I was thinking maybe, what do you suggest?
All righty. Yes, time marches on, unfortunately. So the best treatment for frowns, the 11s as we call them, and horizontal lines is really Botox.
Okay.
And the reason it is because it temporarily paralyzes the muscles that make the wrinkle for about 3 to 4 months. So if you inject Botox in very specific points in the frown area and very specific points in the forehead area, always preserving the ability to move your brows laterally, never going too far to the side.
So it's natural, it's not frozen.
So it's natural looking, exactly. You want to look like no one touched you.
Exactly.
Less is more with this. Okay, so we're ready to put you into position and then to inject the Botox. Now that you're in this position where your feet are a little higher than your head, which we call upside down Botox, we can avoid these blue veins and therefore avoid bruising. The first thing I'm going to do is cleanse your forehead. Now, after the numbing cream, which was put on previously by our nurse, is absorbed, I'm going to ask you to basically relax a little bit. Probably the first time all day that you've had some relaxation. Try to place yourself in some beautiful Caribbean place with some turquoise waters. And again, the goal is to have a very, very natural result. So we will begin today in the frown area with the first injection right in between the two brows, getting that muscle that causes frowning. Then the right frown, then the origin of the muscle. Just perfect. Now let me see you raise your forehead. There you go. So the next series of injections are going to be in the horizontals to remove the horizontal forehead wrinkles. And the first injection is here. And a nice simple line is made up towards the scalp. We will begin now on the second line to take care of the horizontal forehead wrinkles. Just perfect, nice and conservative. And the reason you don't see any marks on the patient's forehead is because this is a very, very, very small needle that is imported from Japan. It's basically an acupuncture needle with a tiny hole in it. And as a result, when we inject our patients, there is no visible sign of having had an injection. Now that I've finished the frowns and horizontals, I can move the patient into a more vertical position where his blood goes back the other direction because it successfully prevented any bruising in the upside down position. The last thing I like to do is to apply very, very, very cold synthetic ice, which massages the Botox in so that it dissipates no more than the size of a dime and stays exactly where I put it. The cold prevents bruising as well and actually feels a little soothing to the patient. As you can see, the pinkness is from the very, very cold ice, and the Botox will kick in about 3 to 5 days. In that period of time, you will no longer be able to make these frowns or horizontal wrinkles, but you will still have motion in the corner of the brow. So you did terrific.
Fantastic. Thank you so much.
You're welcome.